I live in central Scotland. I do a variety of things. I do work around peer research. I'm involved with a number of voluntary organisations, third sector organisations, charities in Scotland that deliver support to people with mental ill health. And I also do some policy work around ensuring that the voice of people with lived experience of mental ill health is heard by government and by official bodies and forms a part of the policy making process.
Okay, and I'm Gillian McIntyre, and I'm a senior lecturer in social work at the University of Strathclyde in Glasgow in Scotland, and I have a particular interest in teaching and research in the areas of mental health and learning disability. And recently my work has had a particular focus on citizenship and the meaning of citizenship to people who have been excluded or marginalised. And Gordon and I have been working together for a couple of years now on a particular project around this.
That's a difficult one. Some of what I do is on a voluntary basis, and some of it is as a self-employed consultant. So I don't have a job as such. So my days can be very different. Sometimes it involves reading and writing. Sometimes it involves meetings with other peers or delivering services directly. Sometimes it involves planning and governance work. I don't think there is anything that could be called a typical day as such.
And my days are similar, well, not similar, but again, I don't have a typical day as such. So my job involves a bit of teaching, a bit of research, and a bit of administration. So on the whole, I teach social work students at different levels. So qualifying students, so people who are training to become social workers, but I also teach qualified social workers with a particular interest in mental health who are training to become specialist mental health officers, which is a role with a great deal of responsibility in Scotland, because the mental health officer is essentially responsible for making the application that would have someone perhaps detained under the Mental Health Act, and they're also responsible for ensuring that people have their rights upheld within that process. So that's a core part of my job. The other part of my job involves doing research, and as I said, recently my research has focused on citizenship and mental health, but I'm also particularly interested in anything that's looking at the rights of people who have been excluded or marginalised, such as people with learning disabilities. I currently have 10 PhD students, so that keeps me quite busy as well. And I also coordinate our service user and carer network, which I'll probably talk a bit more about later.
So around recovery, we have an organisation called the Scottish Recovery Network, which has been around since about 2004. And their job really is to promote and support the introduction of a recovery methodology across really all services in Scotland. And I think over the past years, I think it's fair to say that most, if not all, services now have a recovery focus. It certainly is official government policy that services should focus on recovery in the way that it's defined as, not recovery in the sense of becoming totally free of an illness, but of living well with that illness, whether symptoms are there or not. I think peer support in a formal sense has a fairly mixed history in Scotland. There was a period a couple of years ago where quite a number of peer support workers were trained. So there was an actual qualification designed that someone could go to college and become an accredited peer support worker, and then work on the wards with inpatients in mental health wards, so that they were providing direct peer support to people who were in hospital. Over the last few years, the numbers have declined quite a bit, partly naturally as people left or moved on to other things, but partly in response to the financial situation and the fact that quite often when difficult decisions around funding were taken, health boards who provide the services saw peer support perhaps as not as important as nursing staff. So the numbers have definitely declined. An awful lot of peer support is provided through charities and third sector organisations. So it may not be as formal, but for example, Bipolar Scotland, which is an organisation I've chaired for a number of years as a director, has 17 peer support groups around the country where people either who have the diagnosis of bipolar or family, friends, carers can come together and discuss and support each other. We also run what we call self-management training, which is a 3-day course which is around teaching people to recognise their own behaviours and the triggers and early warning systems that might lead to either an episode of mania or of depression. And those are delivered with people with lived experience of bipolar. So there is a kind of direct peer-to-peer learning approach there. So I think there is an ethos of peer support, but an awful lot of it has now become informal rather than informal in Scotland.
Great. So will I picking up on a couple of the points that Gordon raised. So it was quite interesting, the approach taken in Scotland around this formal training of peer support workers. And actually, there is quite a limited research evidence base to show how successful or otherwise that was. But some of the anecdotal evidence suggested that perhaps taking on the role of peer support worker wasn't always as beneficial for individual peer workers themselves as what it might have been hoped it would be. And that was partly because, being such a new role in Scotland, people found it very difficult to understand what their place was within the broader structures and systems. And often there was a sense of people feeling that their views weren't always listened to, they weren't necessarily taken seriously, and it actually resulted in a lot of people feeling quite isolated and stressed by the role. So that formal role perhaps didn't have the positive outcomes that might have been hoped. And I think the much more informal peer support that Gordon has described has been much more successful within a Scottish context. I think picking up on the discussion about recovery in Scotland, as Gordon has already said, it forms a sort of central plank of government policy. So the latest mental health strategy in Scotland has a central component which is based around this idea of recovery, and we're very lucky to have the national resource that is the Scottish Recovery Network. I think in some respects, the kind of concept of recovery in Scotland has almost been a victim of its own success in some ways. And there has almost been a little bit of a backlash against the concept, and with organisations such as Recovery in the Bin, for example. And what we're finding is that because recovery has been framed as something that's very unique and personal to the individual, which is really important, isn't it? That's what recovery is all about. What has happened is that's transferred the responsibility for recovery onto the individual at the expense of everyone around the individual. So there's a sense that if the individual isn't achieving recovery, it must therefore be their own fault or they're failing in some way. So there has been a bit of concern around that aspect of recovery and a little bit of a kind of backlash. And I think that's where the peer support comes in. It's really important to kind of guard against that over-individualisation that we've been seeing in Scotland. Just to say a little bit in terms of citizenship-oriented practice, we talked about this earlier, Gordon, and what we kind of feel within a Scottish context, if you were to ask someone within health or social care, what do you understand by citizenship-oriented practice? It wouldn't necessarily be something they were particularly familiar with. In terms of the Scottish policy landscape, citizenship isn't up there in the same way that recovery currently is. And I would say in Scotland, we're very much at the stage of understanding what citizenship looks like and what it means for people with mental health problems, and thinking about what benefits would there be in working in a much more citizenship-oriented way. So we're at the very early stages, I would say, in that respect.
Yes, I mean, I think, terminology is always a difficult one, particularly when we're in an international context where terms might not quite be, what might not mean the same thing in one country as they do in another. Certainly in terms of service user involvement, we are a fair way down the road in Scotland to that being seen as a normal everyday thing to do. Recently, our Minister for Mental Health announced that the main Mental Health Act was to be reviewed with a view to moving it more to a human rights base. Now, human rights and citizenship are not quite the same thing, but I think they occupy similar territory. Whole of Scotland, we've recently achieved funding through our national lottery here to bring in a worker to further develop our self-management training course. At the moment, we run 2 or 3 courses a year for a dozen people. We'd like to expand that. And we're also very keen on making the argument to health providers that actually they should be paying for this course. Because our argument is that by keeping people well, we are actually ultimately saving money to the health service. Prevention and early intervention is better than somebody becoming ill and then having to be treated. Also, as I said, our network of peer support groups is very important to us and is very much about people learning from each other. And quite often, one group we get coming along quite often are parents of teenagers or older children who've been newly diagnosed and who are at the stage of saying, I don't really understand this. I want to help my child, but I don't know what the best thing to do is. And we find that the best way for them to learn and to gain knowledge is to talk to peers, to talk to other people who've been in a similar situation and can tell them, I tried this and it worked, I tried this and it doesn't work. Now, the nature of recovery means that what works for one person won't necessarily work for another, but it's a good starting point to know something has worked in some situations. I also do a range of peer research work. One of the projects that we did last year was around looking at the involvement of people with mental health conditions in wider community life. Because we find that quite often when someone is diagnosed with a mental illness, they become very isolated. They're not as involved in their community. And we wanted to find out whether that was by choice or whether there were particular barriers they thought they faced and what sort of supports might be able to be put in place. And what we found was that an awful lot of people did want to be more involved in their community, and they saw peer support as an important way to gain that introduction. We found that when people were involved in community groups, most times it was because they knew someone else who was involved. So it wasn't somebody seeing, a notice of a meeting on a poster or in a newspaper and thinking, oh, I'll go along to that. It was more because someone else said, I'm going, would you like to come with me? And having that support of another person helped them overcome some of those initial barriers. Because there is, while I think stigma around mental health status is reducing, it is still a very prevalent issue. And the fear of stigma is very prevalent as well. So we had people in focus groups telling us, as someone who has a mental illness, I couldn't stand for election to public office because if people knew I had mental illness, they would stigmatise me, they would call me all the names we know about, they would never vote for me. But as I say, peer support was pretty much universally seen as a good way of helping people to be reintroduced into society. So what we now want to do is to take that research and argue to policymakers that we have shown another reason why they should be putting more money into peer support.
Okay, so Gordon does so much, I feel like I can't quite keep up. But one of the important aspects of my role, which I think does a bit to kind of promote peer support and recovery, is around our service user and carer network, which I have responsibility for coordinating, and I have done that for many years now. So when the network was set up, its primary purpose was to influence all aspects of the education and training of social workers across the programmes that we deliver here in the university. The rationale for that was in order for our programmes to be validated, we have to show the government the extent to which people with lived experience have been involved in the programmes. So that's the starting point. But obviously, when people do get involved, and that has been tested and evaluated, the feedback from students is overwhelmingly positive in terms of the learning that they experience when they work with people who have had a social worker in their life. It's far more relevant and powerful than anything that they can read in a book, for example. So students are overwhelmingly positive about service user involvement. So it's something that, regardless of whether we were required to do it or not, it's something we believe really passionately in, and it's something that we would do regardless, because the learning that comes from that is so powerful. So the network serves a very particular function, but over the years, as the network has developed, it's become very apparent that there is a really important peer support role that bringing people together from a very diverse range of backgrounds has developed. So people who really perhaps lacked confidence when they first came to work with us and felt they could never stand up in a classroom full of students now have the confidence and the ability to do that, and are actually supporting other people to come along and do the same thing. So we've introduced a really successful mentoring program within the network. So more experienced members of the network will support new members to develop their confidence and their self-esteem and their skills to enable them to contribute across the programs. And they're involved in all aspects of the training, from lecturing to assessment to selection of students. So it's a really comprehensive program that we've got in place, and it's something that we're very proud of. Another part of my role, I think, where I try to promote sort of peer work would be in all of the research that I do. So I feel very strongly and very passionately about the use of accessible methods, which mean that people can be meaningfully involved in the research process from the beginning right the way through the process. And all of the work that I do always has a substantial peer support element to it, a peer research element to it. I think it's really, I think it can be really powerful. Just as an example, I did a piece of work around homelessness and the importance of social networks in overcoming homelessness. And all of the interviews that were carried out by myself and a peer researcher. And the peer researcher would always be someone who had also had experience of being homeless. And when the person being interviewed realised that the other person interviewing them shared that experience, it was like a visible barrier came down. It was so powerful to watch, and it was almost then like I didn't need to be in the room, because they were having a conversation about that shared experience. And I really believe that the quality of the data and the information that people shared when they knew that the other person had the same experience as they did, it was transformative, and it really did result in better research. And that's something that happens, you know, in most of the research that I do. So I think that's another important part of my role, certainly. Yes, yes, we have. We've worked together. We've been working together for it. So our paths cross in a number of different projects, yes. But there's one particular project that we've been working on together for a couple of years now, and that is developing the model of citizenship for Scotland, which has aimed to replicate the work carried out by Michael Rowe and colleagues at Yale University, where they developed a model of citizenship. And we've been working together on that project for quite a long time. I've been one of the researchers on the project, and Gordon has been one of the peer researchers on the project. And together, in the early stages of the project, we carried out a number of the focus groups together, didn't we? Yes. And Gordon has been, and he'll say more about that, has been involved in all stages of the process. So from undertaking focus groups to carrying out a process called concept mapping, where we tried to make sense of the information that people had given us, to analysing the data and developing the model of citizenship for Scotland. So I don't know if you want to say something about it, Gordon.
Yeah, I mean, it was a really interesting project to be involved in, because it was replicating something that was done at Yale. So right away there is a sort of cachet about Yale being involved in it. But also I was very interested to see just how citizenship as a concept differed between the USA and Scotland. Two very different countries, two very different political systems. The US has a written constitution that promotes, we the people citizenship, whereas it's a term that is perhaps not as regularly used in Scotland, and my suspicion was always that it might not be as well understood. And I think that the research showed that the term meant a lot of different things to a lot of different people, but there were some commonalities around some of the same issues that they found in the US. So some of the rights that come from the fact that you are a citizen, some of the responsibilities perhaps you have as a citizen to your fellow citizens, to wider society, were things that people were pulling out. Again, as a peer researcher, I found it a very interesting process. And again, as Gillian said, and as I've always found in pieces of research, when people know you have a similar experience, they will open up to you more. They will tell you things that they might not tell someone that they identify as, purely an academic researcher. So I think what was powerful for me in that project was the combination of peer researchers and academic researchers taking the best of both to do something that I don't think either of us could have successfully done on our own. I think I learned a lot about the academic rigour that's required. as a peer researcher, and again, we were having a conversation about this just earlier this morning, as a peer researcher, there is a fine line to be drawn between using your own experience to connect with someone, but not getting so close that you're actually influencing what they tell you. So you have to straddle that line of being a peer, but also of being a researcher. And I think seeing how academic researchers approach that sort of issue, because in any occasion where you're conducting research, either in focus groups or individually, people make connections. People have commonalities in every walk of life. But I think it helped me to think about my own practice, to reflect on how I do things, to see kind of how the professionals do it, if you like.
Yeah, and I think as Gordon was saying, to echo that, what really impressed me about working with Gordon is he has this real ability to really be able to actively listen to what other people are saying, and to very quickly take on board what different people with a diverse range of experiences have said, and make sense of that in a way that's very accessible and very easy for people to understand. And that was something that really struck me when I worked with Gordon, and something that I really admire about him. And that ability to kind of straddle that insider-outsider status, if you like. So he doesn't necessarily go into a room wearing his status as a peer as a badge of honour on his t-shirt or anything like that, but when it's appropriate, he's able to come in with that kind of empathy and that shared understanding and experience, while maintaining that level of impartiality. So I've really learned a lot from that in terms of being able to straddle both of those roles, and it's very impressive.
Thank you. I think in political terms, we have a really interesting position in Scotland, that mental health now has a higher political status and importance than it ever has. We have a new Cabinet Secretary for Health and a new Minister for Mental Health, both of whom are very dynamic and very forceful about the need to change. So I think we have some of the conditions in place to move a number of things forward. We've suffered, I think, over the years from the financial situation we've been in the UK, the austerity process, cuts to services, and what that has meant in many areas is that acute services have been prioritised. So many of the community services that perhaps keep people well have been cut or disappeared over the years, which has meant it's far more difficult for people to get support at that level. I think we're now at a stage where the argument that early intervention, prevention, peer support, keeping people well are fundamentally important is being won. And the next stage is to look at how we can transform services in a way that reflect that. So as always, writing the policy is quite often the easy part. Actually implementing it and redesigning it takes years rather than months to do. But I think the fact we have the political will to start that process is really, really encouraging. And peer support is in there as a key component. Recovery focus is very much a central ethos.
Yeah, I think the challenge, I think everyone is signed up to this as a way forward. I think the challenge, as Gordon says, is that currently the way that the system is set up means that it's very kind of focused, it's very crisis driven. So all of the resources go into, particularly, I suppose it's the same in health, but particularly in social work, all of the resources go to crisis services, which means that really nice low-level preventative work, which keeps people well and keeps people safe, is what suffers. So it's about trying to find a way to divert some of the resources from the crisis services into doing that nice preventative work that we all want to see happening. And I think that's where the challenge lies. Obviously, we have quite a lot of uncertainty in Scotland and the UK with the kind of the whole Brexit situation. The potential for independence or not in Scotland is another unknown and another uncertainty. But I think we're very lucky in that policymakers and government are very switched on to this agenda, and they are listening to this agenda. So the political will is there. It's just there's quite a lot of uncertainty at the same time. So we're always going to be positive though and optimistic.
We'll keep fighting.